Let's discuss the 5 transporting points. HOUXI points, LU5, sa CUBIT MARSH. Location in the cubital crest on the radial aspect of the tendon of the bicep. How to find? By slightly flexing the forearm, the bicep tendon becomes more visible. LU5 is located on its radial aspect in the cubital crest. Also located in the area of the cubital crest are P3, ulnar to the tendon, heart 3 at the ulnar end of the cubital crest, and LI11 between the radial end of the cubital crest and the lateral epicondyle. Needling vertical 0.5 to 1 tune. Needle with the arm slightly flexed. Use a bloodletting for heat disorders. Caution, avoid cubital vein. Actions, indication, clear heat in the upper burner, descends the lung qi, regulates the water passages, opens the channel and Luo-Connecting vessels, alleviates pain. Special features, HOUXI point, water point, sedation point, distal point for the lung, local point for the elbow, use bloodletting for disorders of the skin and lung due to excess and or heat. This point is mostly used for interior patterns of excess nature characterized by heat in the lungs with such symptoms as cough, fever, yellows, sputum, and thirst. This point would be applicable at the Qi level, second stage of the 4-level pattern identification characterized by full interior heat in the lungs. Can also be used in chronic condition characterized by retention of phlegm and heat in the lungs, such as may happen in chronic bronchitis. In this case, it would be combined with stomach 40 and other points to resolve phlegm. In cases when lung heat has injured the body fluids, LU5 can be combined with kidney 6 to clear the lungs and nourish yin. In connection with fluids, the explanation of the acupuncture points says that LU5 can be used for sadness and crying deriving from dryness of the lungs, and this point can treat the symptoms by reinforcing the point to promote water. It is also an important point to use in the second stage of whooping cough characterized by phlegm and heat in the lung combined with lung 10, stomach 40. However, LU5 can also be used for interior patterns of an excess cold nature with retention of cold phlegm in the lungs manifesting with such symptoms as cough with profuse white sticky sputum and chilliness. In all these 8 cases, this point would be needled with reducing method. LU5 also has an effect on the bladder in opening the water passages and facilitating urination. It is therefore used for enuresis or frequent urination. The explanation of the acupuncture point says that this point should be reinforced to affect the bladder and kidneys in cases of enuresis. However, this point can also be used for retention of urine caused by obstruction of the lungs by damp phlegm, preventing lung qi from descending and from opening the water passages in the lower burner. In this case, LU5 would be reduced and would be combined with such points as Spleen 9 and Ren 3. Finally, LU5 relaxes the sinews of the arm along the lung channel and can be used in painful obstruction syndrome or paralysis of the arm and or shoulder when the patient is unable to raise the arm. The ABC of acupuncture states when the arm cannot be raised to the head or there is pain in the elbow, use LU5. The illustrated manual of acupuncture point, as shown on the Brunsman, says LU5 can treat painful obstruction syndrome of the elbow and inability to raise the arm. Mostly for excess patterns, resolve phlegm and clears heat from the lungs, opens water passages and benefits the bladder, relaxes the sinews of the arm and shoulder. water point, sedation point, HOUXI, antic-autumn point. As the water point and one which regulate the water passages, LU5 can be used to expel or dry out excessive phlegm, fluid, or dampness in the lungs. Conversely, if there is too little water present in the patient may feel parched with a dry cough, bronchitis with much mucus, or rigid in mind or spirit. Helpful when the patient is depressed, weeping, or sorrowful. Dreams of metal object within water can indicate the need for this point. Thank you for your attention.
Now let's talk about small intestine 3, HOUXI, shoestring point. SI3 is located on the ulnar border of the hand in the depression proximal to the metacarpophalangeal joint at the border of the red and white skin. How to find? We have the quick method: slide from the proximal to distal along the ulnar border of the hand until the palpating finger comes to rest at the junction between the base and the head of the fifth metacarpal bone, proximal to the metacarpophalangeal joint. Here, locate SI3. Or locate with the patient making a loose fist. Locate SI3 at the end of the most distal transverse crease. This often originates between the index and middle fingers and runs to the little finger. When making a fist, a small bulge forms at the end of the crease. There, locate SI3 in a palpable depression slightly proximal and dorsal to the bulge. LI3 is located in a comparable position on the radial border of the hand, located in a comparable position on the foot R, spleen 3 on the medial aspect, and bladder 65 on the lateral aspect. Needling, 0.5 to 1 Sun horizontally below the bone, that is, vertically to the skin towards the palm, or 0.2 to 0.3 Chun obliquely in a distal direction. Caution, this is a painful point. Actions, indications of SI3. Eliminates wind and heat from the Taiyang. We have SI and bladder. Opens the channel and the Luo vessels. Clears heat and benefits orifices. Regulates the Tumai, calms the Shen. Special features: shoestring point, wood point, tonification point, opening or master point of the Tumai. Important distal point for pain, stiffness and contractures along the course of the channel, and for disorders of the cervical spine. SI3 has a wide range of actions. Firstly, it is the opening point of the governing vessel and is therefore needed for all symptoms of this extraordinary vessel. Many of its indications relate to the governing vessel. In particular, it extinguishes interior wind from the governing vessel. Symptoms and signs of interior wind in this vessel include convulsions, tremors, epilepsy, stiff neck, giddiness, and headache. SI3 also expels exterior wind and is widely used in attacks of exterior wind cold or wind heat whenever there are pronounced symptoms affecting neck and head, such as stiff neck, occipital headache, and aches down the spine and back. SI3 has also a deep effect on the muscles and sinews along the course of the governing vessel, small intestine, and bladder channel. It is therefore widely used for any channel problem along these three channels, in particular in the occipital region. It affects the upper more than the lower back area along the small intestine and bladder channel, although it does have lower back ache among its indications, principally due to its relationship with the governing vessel. It is more effective in acute rather than chronic cases. In combination with bladder 62, it activates the governing vessel and can be used to affect the whole spine and back, upper and lower, in both acute and chronic cases of backache. This combination is indicated only if the backache is either on the spine itself or across the lower back on both sides, but not if the pain is only on one side of the lower back. In man, use SI3 on the left, bladder 62 on the right, heart 7 on the right, and kidney 4 on the left. The treatment is also different according to sex. In men, it is sufficient to treat only the governing vessel by using SI3 and bladder 62. In women, it is better to treat the governing and directing vessels simultaneously by using SI3, bladder 62, lung 7, and kidney 6. The order and laterality of needling in a woman would be as follows: SI3 on the right, bladder 62 on the left, lung 7 on the left, and kidney 6 on the right. The needle should be withdrawn in the reverse order. This combination of distal points is extremely effective for chronic lower back ache in women. These points would be used first to remove obstructions from the governing vessel, and the local points would be used afterwards. Also, in combination with bladder 62, SI3 activates the governing vessel and it tonifies the kidneys as this extraordinary vessel emerges from the kidneys. The use of SI3 and bladder 62 to tonify the kidneys is more appropriate in men than in women. SI3 has an effect on the mind insofar as it affects the brain through the governing vessel. It clears the mind in the sense that it helps the person to gain mental strength, to lift depression, and to gain clarity of mind. Just as SI3 strengthens the spine on a physical level, it can also strengthen the mind and give the person the strength to face difficulties. So SI3 regulates governing vessel, extinguishes interior wind. For epilepsy, headache, dizziness, vertigo, expels exterior wind. For malaria, aversion to cold, fever, febrile disease. Benefits in use. So for stiff neck on occiput, occipital headache, difficulty in turning neck, pain in upper back and shoulder, lower back ache. Benefits eyes, nose, and ears. For deafness, tinnitus, blurred vision, redness and pain of the eyes, swelling of the eyes, and nosebleed. SI3 and bladder 62 used for chronic backache in men, combined with lung 7 and kidney 6 for chronic backache in women. SI3 and bladder 62 tonify the kidneys. SI3 and bladder 62 clear the mind and lift depression. Thank you for your attention.
Okay, let's discuss the extra points. Erjian, tip of the ear, EX, H and 6, and Jiachengjiang, adjacent to container of fluids. Location on the apex of the ear, on the helix. How to find, fold the ear anteriorly so that the posterior portion of the upper helix covers its anterior part. The point is located at the highest point of the fold. This is also the location of the auricular point 78. Needling vertically 0.1 to 0.2 tune. Some authors advise to bleed this point for heat conditions, but is not recommended owing to the danger of causing an otic hematoma. Indirect moxibustion for vision disorders. Actions, indications, it clears heat, alleviates pain, benefits the eyes and the throat. Indication, redness, swelling and pain of the eyes, superficial visual obstruction, pain and swelling of the throat, mumps, one-sided headache, high fever. Commentary, this point was first discussed in the Great Compendium of Acupuncture and Moxibustion, which recommended the application of 5 cones of moxa for the treatment of superficial visual obstruction. Adjacent to container of fluids, Jiachengjiang, EXHN. Location, 1 tune lateral to the center of the mental labial groove. How to find, this point is located on the mental foramen. REN 24 is located in the center of the mental labial groove. Needling 0.3 to 0.5 tune vertically or up to 1 tune obliquely towards the mental foramen. Actions, indications, dispel wind, opens the channel. Actions, eliminates wind, activates the channel, and alleviates pain. Indications, deviation of the mouth and eye, pain of the face, toothache, swelling of the gums, jaundice. Commentary, the point Jiachengjiang was first mentioned in the 1,000 ducat prescription. Clinically, it is most commonly used for the facial paralysis and trigeminal neuralgia. Thank you for your attention.
Now let's talk about large intestine 5, Yang, Xi, Yang stream, a Jing River point. LI5 is located with the thumb abducted in a depression between the tendons of the extensor pollicis longus and brevis muscles, the anatomical snuff box on the radial aspect of the wrist. How to find? The anatomical snuff box is a depression on the radial aspect of the wrist formed when abducting the thumb. Holding the hand in a horizontal position, it opens towards the body. LI5 is located on the wrist joint space, which becomes palpable by moving the wrist. Lung 9 is also located on the wrist joint space and can be found by moving anteriorly from LI5 across the short tendon of the extensor pollicis muscle. Needling vertically 0.5 to 1 Shun. Caution, avoid the superficial cephalic vein. Actions, indications, supports the wrist joint, clears fire and expels wind, clears fire from the Yangming. We have the large intestine and stomach, and calms the Shen. Special features, Jing River point, fire point. Important local point for disorders of the wrist together with TB4, SI5, heart 7, P7, and lung 9. This point has similar functions to LI4 in releasing the exterior and expelling wind heat in the beginning stages of exterior invasions. However, in these situations, LI4 would be preferred as it is stronger in its action of releasing the exterior. LI5 clears heat in the large intestine and is used in febrile diseases. In connection with this function, this point calms the mind and opens the mind's orifices. When there is fire in the bright yang causing manic behavior, propensity to inappropriate laughter, and fright. Similarly to LI4, LI5 benefits the eyes, ears, and nose and is used for sneezing, nosebleed, tinnitus, deafness, ear pain, redness, swelling and pain of the eye, lacrimation, toothache. LI5 is frequently used for painful obstruction syndrome of hand and wrist. So LI5 releases exterior and expels wind, clears heat in the large intestine, calms the mind and opens the mind's orifices by draining fire in bright yang, benefits eyes, ears, and nose, frequently used for painful obstruction syndrome or P syndrome of the wrist and hand. LI5 is the Jing River and fire point of the large intestine channel, and in common with the fire points of all the 12 channels, has a strong action on clearing heat. Thus, whilst its area of action, the nose, ears, eyes, teeth, head, and throat, is similar to that of LI4, its action is primarily to clear heat and fire in these areas. When heat obstructs the nose, there will be bleeding or rhinitis. When heat ascends to the ears, there will be tinnitus, deafness, and pain. When heat obscures the eyes, there will be redness, swelling, and pain of the eyes. Superficial visual obstruction and lacrimation. When Yangming channel heat inflames the teeth and gums, there will be toothache, and when heat accumulates in the throat, there will be swelling and congestion. Yang stream, as the fire point on the large intestine, carries the purifying and animating aspects of fire to help revitalize the large intestine. When the world has lost its shine for someone, or if they are preoccupied with self-cleansing or feel unworthy of good things happening to them, the uplifting and illuminating aspect of fire within large intestine can admit some light into the dark depths of large intestine and promote a fresh outlook. The influence of fire can help the large intestine reassess what is of value and nourishment and keep its functioning at the correct temperature. Too cold and metal can be frigid in demeanor. Too hot and there is agitation and possibly constipation. The natural flickering movement of fire helps counter the downward movement of large intestine. It lifts the spirit and helps it maintain connection with its purpose and with the Shen. Good with LI4, great eliminator for its purifying and eliminating qualities. Severe imbalance of the Po and Shen arising from disharmony in metal, particularly heat in the large intestine, can lead some people to feel disconnected from their own body, unreal, or to see ghosts or become manic. As the fire point and Jing River point, Yang stream clears heat to reestablish the calm environment needed for the Shen to rest in the heart and help the person feel re-embodied and less agitated. In this way, it calms the spirit. It has similar properties to LI4 in expelling wind heat and releasing the exterior, but is less frequently used as LI4 is more powerful. As a Jing River point, where the Qi is said to be flowing along like a river, it can be used for clearing heat, generally from the large intestine and its partner in Yangming, the stomach, as well as from its metal element partner, the lung. and is used to clear heat or wind heat from the skin or blood. As a Jing River point, it will help clear pain and stagnation in the hand and wrist, especially if there is heat involved. So LI5 is a far point, Jing River antique late summer point. This often neglected point can have a remarkable effect on certain mental disorders. It is said to be helpful for people who see ghosts and spirits, when it is commonly sedated. Also for mad people who want to throw off their clothes, often used together with LI4 for their purifying and enlivening effects. Consider for tinnitus, deafness, skin disorders, incoherent speech, stuttering, pain, arthritis of the hand, thumb, or wrist can be used to warm a cold or inert metal CF. Thank you for your attention.
Let's discuss the spleen channel, Luo-Connecting vessel system. Pathway, the spleen Luo-Connecting channel separates from the spleen primary channel at its Luo-Connecting point, spleen 4. It forms a three-dimensional reticulate network, dividing into multiple branches and sub-branches within the surrounding tissue. Horizontal division ran to the interiorly-exteriorly paired stomach primary channel. According to some schools of thought, for example, they travel as a transverse spleen Luo-connecting vessel of the Yuan-source point, stomach 42. A longitudinal division follows the pathway of the spleen primary channel, enters the abdomen in the inguinal region, and connects with the large intestine and the stomach. Clinical importance, pathology, excess, colicky pain in the stomach and large intestine, deficiency, drum-like abdominal distension such as digestive disorder in children, abdominal fullness, and distension, ascites. Counterflow Qi, acute vomiting, diarrhea, severe abdominal pain. The great Luo-connecting vessel of the spleen. Pathway, the great Luo-connecting vessel of the spleen begins on the lateral aspect of the thorax at spleen 21. It contains the blood of the Luo-connecting vessel and disperses to the vessels of the whole body, covering them in a net-like fashion. Clinical importance, excess, pain in the whole body, polyarthritis, B syndrome, painful obstruction syndrome, deficiency, muscular atrophy, and weakness of the joints in the whole body. From the point spleen 4, the connecting channel links with the stomach channel. Another branch enters the abdomen and connects with the large intestine and stomach. Thank you for your attention.
Now let's go to location methods and tune measurements. This time we talk about the knee region. The greater trochanter forms a distinct projecting bony structure on the hip area. It is one of the endpoints on an imaginary line connecting it with the sacral hiatus. Located on this line is GB30, a third of the distance from the greater trochanter. Another line connecting the greater trochanter and the anterior superior iliac spine is used for locating GB29. For locating and needling points in the knee region, the patient should be in a relaxed supine position with the knees slightly flexed and supported by pillows. This opens up the knee joint and allows for better palpation of the eyes of the knees. A prone position with the support below the feet and ankles is recommended for treating points in the popliteal crease. The upper patellar border marks the location of spleen 10 as well as of stomach 32 to stomach 34. The eyes of the knee are formed by the depressions on either side of the patellar tendon at the level of the lower patellar border. The lateral eye corresponds to the location of stomach 35. The medial eye is the location of the extra point X LE4. The head of the fibula forms a further important reference point inferior to the lateral aspect of the knee joint. For locating GB34, find the head of the fibula approximately where the seam of a pair of trousers would be, and hold it with 2 fingers. By sliding downward, the anterior finger will drop into the depression anterior and inferior to the head of the fibula, which marks the location of GB34. Tibial shaft and medial condyle of the tibia. Below the medial aspect of the knee joint, the transition from the medial condyle of the tibia to the tibial shaft marks the location of spleen 9. This transition is best located by palpating in a superior direction along the posterior border of the medial aspect of the tibia. When using a knee roll, be aware that the soft tissue around this area may be pushed anteriorly, hindering palpation. Thank you for your attention.
Let's discuss the Su-Xiao-Mao ghost point. Lung 11, Xiaoshang, lesser shang. Location on the thumb, 0.1 tune from the radial corner of the nail. How to find the point is located at the junction of two tangents running along the proximal and radial border of the thumb nail, approximately 0.1 tune from the actual border of the nail. Needling 0.1 to 0.2 tune vertically or obliquely in a proximal direction or prick to bleed. Avoid needling the perineum. Actions, indications, frees the senses, regulates the lung qi, clears heat, especially from the throat, opens the channel. Special features, Jingwell point, wood point, Sun Si Miao ghost point, important distal point for the throat, for sore throat caused by wind hit. The classic of difficulty states that Jingwell points treat fullness below the heart. The region below the heart specially refers to the apex of the epigastrium. But many of the Jingwell points, in fact, treat stagnation and fullness throughout the chest region. Lung 11 is indicated for fullness of the heart and of the region below the heart, accompanied by sweating. Its ability to treat stasis and heat in the heart is further reflected by its indication for mania and agitation of the heart. For this reason, it has included under its alternative name of ghost fate among Sun Si Mao's 13 ghost points of the treatment of mania disorder and epilepsy. Wood point, Jingwell, antique winter point, ghost point. This point activates the wood aspect within the metal. It brings decisiveness, growth, and enhanced planning abilities to a brittle, rigid, or cut-off metal CF. It helps maintain the correct balance between the hun and the pu, as in Liber 4. Consider if the skin exhibits a silk-like sheen, restores consciousness and clears heat, helpful for acute sore throat or pain in the fingers. Little merchant, as a wood point of the lung meridian, can activate the wood aspect of metal. The power and responsibilities of the wood element, growth, decision-making, planning, and benevolence will be enlivened within the lung with this point. Lung 11 can provide a sense of rootedness and calm and improved perspective when there is suppression, lack of growth, inwardness, and irritable tension. These qualities and revitalization and movement within metal that this point imparts can alleviate irritation and tension at the level of the mind and spirit, as well as a physical level, for example, from asthma and agitated skin. The relationship of wood and metal is crucial. It keeps us in the correct relationship between heaven and earth. Their opposing movement and characteristics keep us present in the dynamic tension of existence. The liver moves up and outward to the extremities. The lung returns us to the interior. The hands are free to come and go. The pu are concerned with entering and exiting. Without the restraint of the pu, the hun can float off towards the heaven. Without the hun, the pu would descend into earth, and our existence as we know it would be finished. Conversely, wood can bring decisiveness and capacity to stop, to the sometimes never-ending weighing up of circumstances that the lung can get caught in when in balance. The imagination, curiosity, and penetrative thought associated with wood can enhance the instinctive connections made by the lung and also prevent it becoming too cut and dried. Too prosaic and vanishing in outlook, the vitality and sense of abundance proper to the receiver of qi in health can be reinforced by upward impulse of wood in Xiaoyang. stimulates the dispersing and descending of lung qi. Jing well points are where the meridian is at its most superficial and narrow. The qi is at its most unstable, easily influenced, and dynamic at these points. This being where the qi of the meridian changes polarity from yang to yin or yin to yang, qi is said to move outward centrifugally at these points, which is why they are often used to expel pathogenic factors early in treatment. By clearing pathogenic heat, the shen is calm. Little merchants expel heat from the lung, which otherwise would lead to extreme agitation and shen disturbance. The ability of this point to clear heat and restore consciousness accounts for its inclusion as a ghost point. The inner calm and strength are essential to the good functioning of the lung. Lung 11 opens the orifices. Little merchant restores consciousness as a distal point and restores xiang, invigorates the channel. Xiang is the fifth sound of the Chinese musical scale and is the note associated with metal. Thank you for your attention.
Now let's talk about heat and stomach and large intestine, a pattern for constipation. The patterns appearing with constipation may be summarized as follows. Heat, we have chronic interior heat. This includes heat in the stomach and large intestine, heat in the liver. Acute heat in febrile disease, which includes acute large intestine and stomach fire. For qi, we have stagnation of liver qi. Deficiency, we have qi deficiency, yang deficiency, blood deficiency, yin deficiency, and cold, spleen and kidney yang deficiency with cold. Chronic interior heat, heat in the stomach and large intestine. Clinical manifestations, dry stools, infrequent bowel movements, thirst, scanty dark urine, red face, feeling of heat, abdominal pain, dry mouth, foul breath. Tongue is red with yellow coating and red points around the center and on the root. Pulse is rapid and slippery. Treatment principle, clear heat, drain fire, moisten the intestines. Points, LI4, LI11, TB6, spleen 14, spleen 15, stomach 44, stomach 28, the extra point, HOUXI on stomach 29, extra point, HOUXI, reducing or even method. LI4 clears heat in the large intestine and moves the stools. LI11 clears heat in the large intestine. TB6 clears heat, opens the triple burner, and promotes the bowel movement. Spleen 14 and spleen 15 move downwards. Stomach 44 clears stomach heat. Stomach 28 and stomach 29 clear heat and promote bowel movement. When used for constipation, they only need to be needled on the left side to affect the descending colon. The two extra points located one soon lateral to stomach 28 and 29 have similar actions to these 2 points and promote the bowel movements. They also need to be needled only on the left side. Now let's have the case history of a 34-year-old woman who had been suffering from constipation for 10 years. She had only 2 to 3 bowel movements a week, and the stools were dry and small. Her breath had a bad smell. Apart from this, she had no other symptoms. Her tongue body color was normal, but it had a dry yellow coating, which was thicker on the root. Her pulse was unremarkable. This is a case of heat in the intestines. Dry and small stools indicate heat, and this is confirmed by the yellow tongue coating and the breath smell, which indicates that there is also heat in the stomach. Treatment principle adopted was to clear heat in the intestines and benefit fluids. The patient was treated with both acupuncture and herbs. The main acupuncture points used were spleen 15 to clear heat in the intestines and move the stools, stomach 25 and LI11 to clear intestine heat, stomach 44 to clear stomach heat, Ren 10 to promote descending of stomach qi, stomach 36 to promote bowel movements. The points were all needled with even method except for stomach 36, which was reinforced. Thank you everyone for listening.